Hello, my name is Dr. Oshuare, Senior Medical Officer at Pearl Oncology Clinic, and today we'll be talking about breastfeeding and breast cancer. Now, nobody wants to hear the cancer word, whether it be breast cancer or any other type of cancer. But should you be worried about breast cancer while breastfeeding? As a breastfeeding mom, there are certain changes that happen to your breast naturally. For example, the breasts become bigger, they become lumpier, so it might be a bit more difficult to spot suspicious changes like a suspicious lump in the breast. But there are a couple of things to note that can help you to figure out the difference between the natural changes that happen in your breast during breastfeeding or a suspicious lump. For example, a suspicious lump would be firm, probably will not move around like the clogged milk ducts that you may experience from time to time. It may be painless and it may just remain there without changing. If you notice any skin changes as well, or any suspicious changes, please speak to your caregiver. Now, how does breastfeeding complicate breast cancer management? Generally, the drugs or the treatment given to breast cancer patients are not safe for breastfeeding. Let's talk about some of these treatments one by one. For example, in chemotherapy, these drugs are drugs that kill cells that are actively dividing. And of course, a newborn baby is made up of cells that are growing and actively dividing. So chemotherapy drugs most times are harmful to the baby. So it may be a bit more challenging to spot suspicious changes in the breast while breastfeeding, because naturally the breasts during breastfeeding undergo changes. For example, they get bigger, they get more lumpier, so you may not be able to differentiate between the normal healthy lumpy breast and a suspicious cancerous lump. So but for a cancerous lump, usually they are firm or hard, painless, they may not move around, and they just remain there, unlike clogged milk ducts that come and go from time to time. Now, how is treatment affected for breast cancer during breastfeeding? So most of the treatments that we normally give to breast cancer patients are not safe to be given during breastfeeding. For example, chemotherapy. Now, chemotherapy drugs are drugs that attack rapidly dividing cells, like cancerous cells are. But a baby is made up of many of these cells that are growing and rapidly dividing. So obviously, during breastfeeding, you wouldn't want to introduce such drugs to a baby that can harm the naturally healthy growing cells of the baby. Most of these chemotherapy drugs pass through the bloodstream into the breast milk and reach the baby. So, of course, a breastfeeding mom receiving chemotherapy may be told to hold off on breastfeeding while she's receiving treatment. Again, another type of treatment, radiotherapy, can be complicated by breastfeeding. For example, the affected breast may not be able to produce as much milk as it would have if it was not being exposed to radiotherapy or radiation therapy. So a woman who is breastfeeding and receiving radiotherapy may have challenges breastfeeding her baby because of, one, reduced milk production. Number two, the sucking action of the baby on the breast can cause some skin breakage, some skin injuries that can make the woman more prone to having things like infection in her breast as a result of the radiotherapy. Now, a woman who is receiving radiotherapy may have the option of breastfeeding with the unaffected breast, but this depends on the kind of radiotherapy she's receiving and how long she's receiving it for. So you may need to speak with your caregiver on that. Now, other treatment modalities like targeted therapy, hormone therapy, these are all treatments that can be passed through the bloodstream into the breast milk and can also affect the baby. So, unfortunately, breastfeeding and breast cancer, they're not a good mix.